So we're here at ESVS Day 2, and I've been joined by Professor Farber, who is the PI for the BEST-CLI study, which we're going to have a chat about. Would you like to introduce yourself to our audience?
Sure. Good morning, everybody. I am Alik Farber. I'm a chief of the Division of Vascular Surgery at Boston University School of Medicine. I'm a co-national PI along with Dr. Matt Menard and Kenny Rosenfield of the BEST-CLI trial.
So just tell us a little bit about BEST-CLI, what the motivation for this study is for running it and what you're looking at.
Sure. The reason we got the idea to run the study is because there's a lot of questions that remain unanswered in the management of patients who have chronic limb-threatening ischemia. For instance, any given patient, if they were to come to my hospital, might be offered one type of treatment, while going to a hospital next door might be offered a completely different treatment. This sort of drove us to ask the question about what treatment is best for CLI.
Okay, and which two treatment options are you comparing?
We're comparing two treatment strategies. One is a surgical strategy, which typically is an infra-inguinal bypass. And the second strategy is endovascular strategy that's composed of multiple endovascular procedures that might be used to revascularize the limb.
Okay, and we know in the UK the BASIL trials have run, BASIL 1, 2 and 3, which are now recruiting. Where does BEST-CLI fit in the context of those studies, and what do you think we're going to gain from your study that we may not see from the BASIL trials?
Well, BASIL was really a fundamental trial in the space that Professor Bradbury has run and answered a lot of questions, but not all the questions. And so we were in some way motivated by him to start BEST-CLI. BEST-CLI in some way is parallel to BASIL 2, although BASIL 2 is more narrow. BASIL 2 is looking at only infrapopliteal disease, while we are actually looking both at infrapopliteal and femoral popliteal disease.
Okay, so the whole more broad spectrum of patients then potentially.
That's right, a broader spectrum of patients.
At the end.
But a lot of synergy.
Yeah, absolutely. So where are you now in terms of recruitment? When do you expect to finish, and when can we start seeing which way to go? Because I think it's an important study, obviously, for us in the vascular community.
Yeah, so as of this morning, we've enrolled 1,821 patients. Our goal is 2,100 patients. So at some point soon, we're going to cross the finish line and stop enrollment, and then we're going to need to follow these patients for at least a year.
Okay, and your main outcome measure, what are you're looking at principally?
So there are a lot of outcomes measures that have been used in the space. We chose major adverse limb event-free survival as a primary outcome measure because we believe it's a better outcome measure in comparing treatment strategies. So that includes amputation, death, but also major reinterventions.
Okay. So we should see data possibly in 18 months starting to emerge if your recruitment goes on track?
That's correct. That's correct.
Okay, well, thank you very much for joining us. It's very exciting. We look forward to the results, and good luck.
Thank you.